Hi, I'm Dr. Michael Chua with Puente Hills Eye Care, and in this video, I'll discuss diabetic eye disease and diabetic retinopathy. I'll go over what these conditions are, the symptoms they cause, and treatments we have for them. And stick around to the end of the video because I'll also go over some lifestyle changes that you can make to prevent them. Diabetic eye disease is a group of eye problems that affect patients with diabetes. Patients with uncontrolled blood sugars are at an increased risk for developing cataracts and glaucoma, which I've discussed in previous videos. I'll include a link in the description below in case you want to check those out. If patients have high blood sugar for longer periods of time, they can develop damage to the tiny blood vessels of the retina, which is the light-sensitive tissue in the back of the eye. This is called diabetic retinopathy. Let's take a closer look at the eye to better understand what happens in diabetic retinopathy. In earlier stages of diabetic retinopathy, the walls of the retinal blood vessels can weaken, leading to tiny bulges in the vasculature called microaneurysms. These weakened blood vessels can leak fluid and blood into the retina. Sometimes the central part of the retina, or the macula, can also swell and accumulate fluid. This is called diabetic macular edema and causes blurring of central vision. As diabetic retinopathy progresses, these damaged blood vessels become less effective at delivering blood to the retina. This decreased blood supply causes the retina to be starved for oxygen and stimulates the growth of new abnormal blood vessels. This process is called neovascularization. These abnormal blood vessels are weak and fragile and can often cause bleeding in the eye. Eventually, scar tissue from the growth of these new blood vessels can also cause the retina to detach from the back of the eye. Okay, now that we covered how diabetic retinopathy develops, let's review some of the symptoms it can cause. Oftentimes, diabetic eye disease and diabetic retinopathy are diagnosed during examination before any symptoms are noticed. This is one of the many reasons why annual dilated eye exams are recommended, especially in patients with a history of diabetes. As diabetic retinopathy progresses, it can cause blurring or darkening of central vision, particularly if there's diabetic macular edema. If there's bleeding inside the eye, patients can see floating spots or strings as the blood swirls around the eye. Fortunately, there's many treatment options available for diabetic retinopathy. Laser treatment, or photocoagulation, creates little burns in the back of the eye using a beam of light. This method helps to treat leaky blood vessels. Oftentimes, doctors provide this treatment over the course of several office visits. VEGF, or vascular endothelial growth factor, has been shown to play an important role in the development of diabetic retinopathy. Therefore, one common treatment method for diabetic retinopathy is to inject anti-VEGF medications into the eye to block the growth of abnormal blood vessels and to prevent leakage of fluid into the retina. Lastly, if patients have blood inside the eye that doesn't clear up after some time, or if they develop retinal detachments, then they should see a retinal surgeon to discuss surgery to clean up the blood in the eye or to repair the retinal detachment. Okay, now that we reviewed some of the treatment options, let's discuss some lifestyle changes that you can make to decrease your risk of developing diabetic retinopathy. Maintaining adequate blood glucose and blood pressure control is the most effective way to prevent diabetic retinopathy. Healthy eating habits and frequent aerobic exercise are important for everyone, but they're especially important for patients with a history of diabetes and high blood pressure. Also, make sure to follow closely with your primary care doctor to see if you should be tracking your blood sugar levels at home. One common test that doctors order for patients with diabetes is the hemoglobin A1C test, which reflects the average blood sugar over the prior 2 to 3 months. Knowing your hemoglobin A1C levels and bringing results of these tests to your eye doctor will help us to determine your risk for developing diabetic retinopathy. Another important risk factor for diabetic retinopathy is smoking. Studies have shown that patients who smoke have an increased risk of developing complications from diabetes. Therefore, if you have a smoking habit, now is a good time to quit. I hope this review of diabetic eye disease was helpful to you. If you found the information in this video useful, please give us a like and subscribe to our channel for future updates. And if you live in the Los Angeles, Orange County, or Inland Empire area and want to get your eyes checked for diabetic eye disease, feel free to visit our website or give our phone number a call to make an appointment today. I'm Dr. Michael Chua with Puente Hills Eye Care. See you next time.